Well, good morning. My job is to bring the welcome, and so I'll introduce myself. My name is David Lust. I am the head of the Department of Agricultural Sciences here at West Texas A&M University, and we're housed in our ag complex just down the street. And so I want to just welcome you to West Texas A&M, first of all, and also to the Fairley Club, a really nice facility here at our relatively new football stadium. And I'll tell you just a little bit about our Department of Ag Sciences and Veterinary Medicine and some things that we're involved with. And first, I'd just say you're always welcome at WT. We love having guests at WT. Our university, and particularly our Department of Ag Sciences, and also our partners at the Vero Veterinary Education Research and Outreach Program, and I appreciate Dr. Posey, one of our veterinarians in our department, and it works at Vero, being here as well. We're all about helping with the industry and helping solve industry problems, and including veterinary medicine problems and issues that crop up. And we love hosting meetings and outside groups on our campus. We've just finished in the last several weeks. We've hosted 3,100 high school FFA students here on our campus for 23 different contests that we held. We just recently hosted about 800 college students from more than 50 universities and junior colleges around the country for events. We stay busy hosting events because we love having folks like you come to our campus and share our facilities, visit with our faculty, visit with our students. So I want you to know that you're welcome here, and we're very glad that you chose to come to WT for your meeting here today. Just a little bit about our pre-vet program. We have about 1,150 students in our Department of Agricultural Sciences, and around 600, I think, Dr. Posey, would be in animal science or pre-vet. And so we're very much involved in training the next generation of veterinarians in our department in our pre-vet program. Dr. Posey does a great job training those students to be successful applicants. We have right around 100 students that have come through the WT pre-vet program that are in veterinarian professional school right now, and tremendous success with that. Of course, the Vero program is a great partner, along with the Texas A&M Veterinary Medical Diagnostic Lab that is located here in our ag complex, and we've got the AgriLife Extension Center that is under construction here as well. So we're really proud of being at the center of the animal industry and helping industry work on challenges, including veterinary challenges that are relevant to the region. So with that, I will turn it over to others, and I need to get to my next meeting. But I want you to know, welcome to WT. I hope that you have a great meeting here and enjoy your time here at this facility. Thanks.
Good morning, everyone. My name is Christy Oshesky. I'm with the Department of State Health Services as the Zoonosis Control Fellow. I just want to welcome everyone here this morning. I do have a couple of quick housekeeping that I'm going to go over first, and then we'll go into more. So we do offer CE for several different places and professions. You do need to complete your evaluation at the end of the event to obtain that CE registration certificate. I'm not going to read everything on this slide just because it's a lot, but it's basically for the Texas Medical Association and nursing. They do receive 4.5 hours through them. Other professions that we're doing CE for are listed on here as well. So if you fall into this category, again, make sure you are doing the evaluation so you can receive your certificate. Just a little bit of other things to go over. This event received no commercial support. The speakers and planning committee for this event did not disclose any financial interest as well. The speakers also did not disclose the use of products for purposes other than what has been approved for through the FDA. So that was just a little bit of our housekeeping. As far as the lunch will be provided by United. They graciously donated all the food for our event. So we do want to say thank you to them. If you do have a cell phone, we do ask you place that on silent and step out to make your phone calls. All right, so let's go ahead and get started. First off, I do want to thank you guys for coming here to our facility at the West Texas A&M and thank them for allowing us to be here. I also want to extend a special welcome to those of the people joining here in person, as well as on our online venue. Your presence today reflects a shared understanding that human health, animal health, and environmental health are all connected. That's the heart of the One Health approach. In this part of Texas, those connections are especially noticeable. Our agriculture, veterinary medicine, wildlife management, and public health all intersect in our communities. The Panhandle is a place where One Health is not just a concept, it's necessary. HPAI is an example of why this collaboration matters. It impacts wild and domestic bird populations, our food supply, the economy, and has an impact for human environmental health as well. Addressing it requires communication and coordination across disciplines, and that is exactly what today is about. Whether you're here in the room with us or tuning in virtually, thank you for being part of this conversation. We hope today sparks new ideas, partnerships, and actions as we work together to protect the health of people, animals, and the environment. And now it's my pleasure to introduce our keynote speaker, Dr. Sharisa Abdul Hamid. She earned her doctorate of veterinary medicine from the University of Florida and later completed her master's of public health at Texas Tech University. Dr. Abdul has served as the regional zoonosis veterinarian of Public Health Region 1 with the state of Texas for the past 3.5 years. In this role, she has been working on efforts to help prevent and control zoonotic diseases, collaborating with local health departments, animal control, veterinarians, medical providers to protect both animals and human health. She has a diverse background in shelter medicine, emergency care, general practice, and public health. Dr. Abdul brings a wealth of hands-on experience to the field of veterinary medicine and public health. She is also, in addition to her clinical work, has shared her knowledge as a lecturer at Texas Tech University School of Veterinary Medicine and has taught in the veterinary technology program to future veterinary technicians. Her dedication to both animal health and community well-being makes her a valuable leader and advocate in the field of health. Please welcome in joining Dr. Abdul.
Do you know if we can display duplicate your screen?
Good morning, everyone. Thank you for coming today to join us on this CE event. And for those of you all virtually, hello. Like Christy said, I'm Dr. Abdul, fondly known to Region 1 folks. All right. As you can imagine, when I got that phone call, I responded with a deliberate, confused, what? Followed up with the polite version, I beg your pardon. So after hearing words bird flu in dairy cattle a second time, I managed to muster up the most rhetorical question at the moment. How? As if bird flu in dairy cattle wasn't mind-blowing enough, I then received the report that there may be human infections. Bird flu made its big debut in Texas dairy cattle in March of 2024. But that was not the first time in Texas or in the US, for that matter, that bird flu was identified. So like any good villain, avian influenza has an origin story. But before we get into that, let's first get back to the basics. Avian influenza causes respiratory diseases in humans, and this disease can be severe in children, the elderly, and immunocompromised individuals. The influenza season typically runs from October to May, although there are many varieties of influenza virus. Influenza A and influenza B are responsible for most seasonal flu. The influenza A viruses have been found in a wide variety of animals, including bats, dogs, cats, birds, swine, horses, whales, seals, and some of them can be transmitted between humans and animals. Influenza A viruses are further divided into subtypes based on different hemagglutinin and neuraminidase surface proteins. At least 16 hemagglutinins and 9 neuraminidase have been found in birds, resulting in more than 100 subtypes or variations. And these surface proteins are antigens and serve as target sites for immune response, which means they are recognized by the body and trigger a response, including production of antibodies that can fight infection. Influenza viruses change frequently and in two different ways. The first is antigenic drift. Antigenic drift consists of small point mutations that occur during virus replication, resulting in gradual changes to the virus's surface proteins. If the hemagglutinin and neuraminidase proteins change enough, a host existing immune system response against that virus may no longer be protective. The second way that influenza viruses change is due to antigenic shift. Shift is an abrupt change in the virus's subtype through genetic reassortment. The reassortment can result in new surface proteins, and it may be sufficient for the virus to immediately evade the existing immunity in its host species. Avian influenza is an influenza type A virus in the genus Orthomyxoviridae. Its known reservoir are aquatic migratory birds, primarily waterfowl and shorebirds. These birds are typically asymptomatic. However, there are H5N1 viruses that can cause death. It is shed in their feces and saliva as well as respiratory secretions. The fecal-oral route is the primary mode of transmission, and the incubation period lasts a few hours to a few days. Its pathogenicity or virulence is determined by how the virus affects poultry in a laboratory setting. So high-path avian influenza, or HPAI, causes severe infections and contains subtypes H5 and H7. Low-path avian influenza, or LPAI, causes subclinical or mild infections in poultry and contains other H subtypes, including non-HPAI H5 and H7. The low-path H5 and H7 subtypes can mutate into high-path avian influenza. So, had you had your dose of science for the day? But we're just getting started. So we know avian influenza has infected many species of animals, not just birds. There's skunks, cats, foxes, and, like I said before, cows. But how? So let's look at the relationship between migratory birds and livestock. Every year, many species of birds fly in their millions along a flyway between breeding and wintering grounds. And these birds cross large areas of land and sea in search of food and nesting locations. During the migration, stopover locations are used to rest and refuel, and this break can last for months. These stopover locations were wetlands, but in the early 1900s, wetlands were converted for agricultural use. With their natural habitat and food resources reduced, these migratory fowl started to nest on nearby farms and use the surrounding agricultural landscape for food. And in doing so, they risk spreading avian influenza via their contaminated saliva and feces to other animals in the area. So now that that's out of the way, let's get back to this origin story. The first description of bird flu dates back to 1878 in northern Italy when a veterinarian noticed many birds dying from what was described as a contagious disease of poultry associated with high mortality. At the time, it was referred to as fowl plague. Although this instance in Italy is the first known reference to the disease, bird flu had likely been sickening birds for some time. It wasn't until the 20th century that fowl plague was determined to be caused by a virus. In 1918, the 1918 Spanish influenza pandemic was the most severe pandemic in recent history. It's estimated that about 500 million people, or a third of the world's population, became infected with this virus. Approximately 50 million deaths occurred worldwide, with about 675,000 of those occurring in the United States. Mortality was high in people younger than 5 years old, between 20 and 40, and 65 years and older. There was no vaccine, and there weren't any antibiotics to treat secondary infections. This limited control efforts to non-pharmaceutical interventions such as isolation, quarantine, good personal hygiene, use of disinfectants, and limitations of public gatherings. During the same time, as the pandemic was raging in humans, a new influenza-like disease appeared in swine, called swine influenza. It was described in the north-central United States and in Hungary. It was speculated that swine might have become infected from humans or humans from infected swine. However, the possibility that both humans and swine might have received their infections from a common third species was not considered at the time. The virus was later sequenced and determined to be an H1N1 virus with genes of avian origin. Sporadic outbreaks of avian influenza were reported in bird flocks in the 1920s, also continuing on in the 1930s and 40s. Human vaccine development started in the 1930s, and there was a successful production of a bivalent vaccine after the discovery of influenza B. A few years later, it was determined that changes in the antigenic composition of circulating influenza viruses had rendered existing vaccines ineffective, which highlighted the need for continuous surveillance and characterization of circulating viruses. In February 1957, a novel influenza A virus emerged in East Asia. This H2N2 virus was comprised of 3 different genes from an H2N2 virus that originated from an avian influenza virus. It was first reported in Singapore in February, and then in Hong Kong in April. By the summer, it made its way to coastal cities in the US. The virus circulated for a year and caused an estimated 1.1 million deaths worldwide. 116,000 of those occurred in the United States. By the late 1950s, poultry across Europe, Russia, North America, South America, the Middle East, Africa, and Asia had been affected by bird flu. And this includes small flocks on a single farm to tens of thousands of birds. Scientists learned that wild birds served as reservoirs and that they are capable of spreading the virus. It was in 1959 that the first H5N1 virus was isolated following an outbreak in chickens in Scotland. In 1968, we had blood tests confirmed avian influenza in wild birds in the United States, Australia, and Russia. Alas, that discovery didn't stop another influenza pandemic from occurring. The 1968 pandemic was caused by the H3N2 virus. This virus was a result of the mixing of seasonal flu with avian influenza type A virus. And the estimated number of deaths was 1 million worldwide and about 100,000 in the United States. People 65 years and older were mostly affected, and the H3N2 virus is the virus that circulates worldwide as a seasonal influenza A virus and undergoes regular antigenic drift. Scientific, regulatory, industrial representatives from several countries around the world met on April 22, 1981, in Beltsville, Maryland, for the first international symposium on avian influenza. It was at this symposium that the term fowl plague was discarded and replaced with highly pathogenic avian influenza. This terminology change was due to the virus's ability to cause at least 75% mortality within 8 days in 4 to 8 week old chickens when they were inoculated. So as the years went by, influenza viruses of low and high pathogenicity continued to emerge and re-emerge in birds. Some of the low pathogenicity viruses evolved into a highly pathogenic strain, causing high mortality in affected flocks. Zoonotic transmission was not uncommon, at times resulting in fatalities. The emergence of H1N1 in the United States in spring 2009 is one of those occurrences. This outbreak caused an estimated 575,000 deaths globally during the first year that it circulated, and 80% of the deaths that occurred in people were younger than 65 years. This virus was comprised of swine, avian, and human influenza genes not previously identified in animals or people. So from January 2014 to June 2015, outbreaks of high-path H5N2 and H5N8 viruses in domestic poultry and birds were reported in the United States. There were 211 commercial, 21 backyard poultry flocks that were affected, and 75 wild bird detections. 21 states were affected during this outbreak. Total death among poultry was 50.4 million. Then the virus seemed to disappear until 2022. In January 2022, outbreaks of HPAI, H5N1 virus clade 2.3.4.4b in wild birds were reported in the United States. By February, detections of HPAI, H5N1 were made in domestic poultry. Overall, there were 322 commercial and 483 backyard poultry flocks affected, and there were greater than 6,000 wild bird detections. 47 states were affected. The total deaths among poultry was 58.6 million. In April 2022, the first human case of HPAI, H5N1, was reported in the United States, and it's speculated that the detection may have been the result of contamination of nasal passages by the virus and not an actual systemic infection. In Region 1, the Panhandle, we can appreciate that there was HPAI detection in wild birds. And during that time, there were also sporadic detections of HPAI, H5N1 in carnivorous mammals in the US, as well as other countries around the world. And this trend continued into 2023. In the United States, there were detections made in seals, foxes, bobcats, coyotes, skunks, otters, bears, as well as captive cats, such as tigers and leopards. Globally, detections were made in these same species, as well as mink, polar bears, elephant, and fur seals. In March 2023, Texas had its first mammalian detection of H5N1 in Carson County. A skunk was found in an area that recently experienced a bird die-off caused by HPAI. The skunk was observed during the day, apparently very active, but it was stumbling and circling and walking sideways, according to reports. It was also approaching people. Out of an abundance of caution, the skunk was first tested for rabies, and after confirming its rabies negative status, it was tested and confirmed positive for HPAI. During the fall of 2023, wildlife rehab centers were seeing an increase in the number of migratory geese that were believed to be infected with botulism. Some of these birds did not exhibit a typical limber neck appearance. They were balancing themselves by pressing their beaks into the ground, with their feet splayed, and some had their wings fully extended, swaying from left to right. If they attempted to walk, they would circle before finally stumbling over. Once down, they would experience erratic behavior as they were trying to get themselves back on their feet. Other clinical signs observed were bilateral conjunctivitis and corneal edema. Ocular and nasal discharge were not a consistent clinical sign. Citizens were also making calls about low-flying geese being hit by cars or wandering in the busy streets. In February 2024, an unknown illness began to affect multiple dairy cattle in the Panhandle. The cows were mid to late lactation and predominantly second lactation or older cows. And some cows were open, some were bred, and several dairies became affected, which seemed like simultaneously. Clinical signs observed by attending veterinarians included decreased rumination, hyperthermia, which is a fever ranging from 104 to 108 Fahrenheit, indigestion, dehydration, anorexia, decreased lactation, and changes in milk consistency, with the milk having a yellow and thick-like colostrum appearance. Pneumonia and diarrhea were not consistent findings. Some cows also had erythema of the nares and nasal mucosa, and there were those that showed signs of vasculitis of the vaginal vestibule. The duration of clinical signs lasted approximately 15 days, with peak signs occurring between 2 and 5 days. 10 to 15% of cows in the herd were affected. Mortality was less than 1%, and the average milk loss for the herd was 10 to 20 pounds, and this was sustained for 3 weeks before slow return to production. So to put these numbers in perspective, if a dairy had 10,000 head of cattle and 10% of these cows were affected, we're talking about 1,000 cows that were ill for 3 weeks. And can you imagine having to treat 1,000 cows every day, 2 to 3 times a day, for 3 weeks? That's what these dairies were going through. So dairy veterinarians were submitting milk, blood, urine, and fecal samples to TVMDL, or Texas Veterinary Medical Diagnostic Lab, in the hopes of solving this problem. A list of differentials for the syndrome was formulated, but diagnostic test results did not reveal a consistent cause. As a diagnosis for the clinical syndrome in cows is being sought, other species appear to have a syndrome of their own. Cats that lived on the premise appear to be blind. They experience ataxia, which is an unsteady gait and circling. The affected cats died within 12 to 24 hours. There were also reports of cats that seemed to disappear overnight. Besides cats, there were birds, black birds like grackles, behaving peculiarly. The birds appeared disoriented, and they would fly into the milking parlor, one of the loudest areas on a dairy farm, and settle in the darkest places. Workers would pick them up and put them back outside, only for the birds to fly back into the milking parlor, and these birds would be found dead within 12 to 24 hours. In addition to cows, cats, and blackbirds, there were also backyard non-poultry flocks affected in Moore and Deaf Smith counties. Discussions between veterinarians and agencies ultimately led to the concern and subsequent testing of the birds and cats on the dairies for HPAI. When the bird and cat samples came back positive for HPAI, it was decided to test cattle samples for HPAI as well. Results of the banked cattle samples show non-negative results from milk, urine, nasal swabs, mammary glands, lung, and lymph nodes. The samples were sent to the National Veterinary Services Laboratory for confirmatory testing, and they were confirmed as HPAI positive. So to recap, dairy cows became affected with a syndrome that caused high fevers, sudden decrease in milk production, and changes in milk consistency. Some affected premises also experienced either the sudden death or disappearance of cats and dead or dying birds. But what was also appreciated by the dairy vets was the appearance of employees, particularly the changes in their eyes. So the dairy vets observed palpebral edema, periorbital edema, conjunctivitis, scleral injection, and serous or mucopurulent ocular discharge in employees. Some employees experienced 2 or more clinical signs simultaneously, lasting on average a week. And some employees also experienced respiratory illness. The vets appreciated on average 5 employees a week. After much convincing, it was agreed that conjunctival swabs would be collected in addition to nasopharyngeal swabs for bird flu testing. Testing at our regional offices were arranged to accommodate employees, and this was very challenging. Some employees drove past the offices, they parked and then left, or they just never showed up. There were 13 employees that were tested on site at a dairy, and those results were all negative for HPAI. But to mention here, these 13 employees were at least 4 days into the disease process. On 3/28/2024, one person showed up to our Dumas office accompanied by one of the dairy vets. And this person was a 25-year-old male of Hispanic descent. His physical exam was fairly unremarkable besides having an elevated blood pressure. The clinical signs observed that day was his right eye had episcleral injection and there was serous ocular discharge of 12 hours duration. He had been working with sick cattle the day before. He did not wear goggles or a mask, only gloves. And this is what his eyes looked like. Nasopharyngeal and conjunctival swabs were collected and submitted to the LRN for testing. This individual received Tamiflu for himself and his roommates. A follow-up exam was performed the following day, and this is what his eyes look like. His test result returned as presumptive positive that day, and on the 1st of April, CDC confirmed the sample as positive. So how did this patient become infected? Was it via contact with the birds or perhaps the cats? What about the cows? To dig a little deeper, we may also have to ask, well, how did the grackles, the cats, and the cows become infected? So let's break this down a bit more. So in this section, we're going to discuss the epidemiology, clinical findings, diagnosis, treatment, and prevention for several species. We're going to start with poultry and wild birds. So the virus is shed in infectious materials like feces, respiratory secretions. And if a bird dies, its body, including the feathers, are also infectious. Transmission occurs primarily via the fecal-oral route, but is also possible via aerosolization, fomites, and mechanical vectors. The incubation period lasts from a few days in the individual birds to about 2 weeks in a flock. Virus shedding begins 1 to 2 days after infection and can last up to 36 days in chickens and 72 days in turkeys. Morbidity and mortality can be 100% with high path infections in poultry. With birds, wild birds are typically asymptomatic, although some H5N1 can cause death. Low path infections can result in decreased egg production and misshapen eggs. There is also decreased fertility or hatchability of the eggs. The birds may experience respiratory signs such as sneezing, coughing, ocular and nasal discharge, and swollen infraorbital sinuses. Birds may appear lethargic and have decreased feed and water consumption. Flock mortality may be somewhat increased. With high path infections, that can result in a decrease in egg production, but the eggs may be misshapen, depigmented, or even shell-less. Neurologic and respiratory signs, such as coughing, sneezing, and blood-tinged oral and nasal discharge, may be present. Birds may show signs of depression, diarrhea, and anorexia, ecchymosis of the shanks and feet and edema, and cyanosis of unfeathered skin on the head, the comb, wattle, and or snood. Sudden death can occur with few or no preceding signs, and 90 to 100% of the flock is affected. Wild bird flocks infected with certain strains of high path avian influenza may experience sudden die-offs. Well, there are several disease conditions that can resemble HPAI. And the diseases are virulent Newcastle disease, avian pneumovirus, infectious laryngotracheitis, infectious bronchitis, chlamydia, mycoplasma, and acute bacterial diseases. For veterinarians and others in the veterinary field, there are several diagnostic tests available. If you are collecting samples from live birds, you may submit oropharyngeal, tracheal, and or cloacal swabs. Tissue samples from several organs are an option if the birds are deceased. It is best to call the diagnostic lab to ensure you are collecting a sample in a manner and quantity suitable for the lab. Also, if HPAI is suspected, your suspicion should be reported to the appropriate agencies. More on that on the next slide. Appropriate PPE should be worn when samples are being collected. If a flock is positive, the infected premise will be quarantined and the entire flock will be eradicated to control further spread and limit mutation of the virus. Nearby flocks in the buffer zone will be monitored and tested for HPAI and movement control initiated. Because there is no treatment for avian influenza in poultry, preventing introduction into the flock is key, and this is done by enhancing biosecurity protocols. And this is for commercial as well as backyard poultry flocks. Poultry housing should be regularly checked and maintained to keep wildlife and pests out. Visitors should be kept to a minimum. Hands washed before and after contact with live poultry. PPE should be worn as well as provided. Clothes changed before interacting with poultry. Equipment should be cleaned and disinfected, and equipment should not be shared with other producers. Backyard poultry producers should be attentive for water sources on or near their premise and keep poultry contained if there are any wild birds present. Sick or dying birds should always be reported to your local veterinarian, cooperative extension service, or state veterinarian. Anyone who was exposed to an infected animal will be monitored for 10 days after the last day of exposure. The epidemiology of HPAI H5N1 in cattle is under investigation. To date, we know that there is high viral shedding in milk. Urine and respiratory secretions have significantly lower levels. The proposed mechanism of transmission include direct contact with milk, inhalation of aerosolized virus and aerosolized spread to neighboring sites, indirect transfer by fomites, and that includes workers and visitors, equipment, and vehicles. The incubation period can be several days to weeks, while virus shedding can last for months. Morbidity is on average 10 to 20%, but can be as high as 40% if there are other stressors present, such as extreme heat. Mortality is less than 5%. However, infected herds are at increased risk for elective culling due to failure to return to pre-disease milk production levels, as well as secondary disease or comorbidity. Now, this graph shows that bulk milk testing can be used as an early detection system for HPAI in lactating dairy cattle. Samples were taken from 2,500 lactating dairy cows, and you can appreciate a drop in PCR test values 16 days before the herd outbreak was noticed. The number of new illnesses remained at baseline during this time. The PCR test values continue to decline, and at day 0, as test values measure less than 26, there is a spike in new illnesses. 4 days after the herd outbreak was noticed, test values were at their lowest. This corresponds with the highest number of virus found in the milk. To note, millions of viral particles are found in a few drops of milk. As the days pass, more and more cows become ill, and eventually the number peaks at 63 new illnesses in one day. After this time, the number of illnesses begin to decrease and the test values begin to increase. So clinical signs and disease severity of HPAI H5N1 in dairy cattle vary. Several clinical signs have been observed, with the signs listed on the right being the first ones appreciated during the 2024 outbreak. The differentials for cattle with HPAI H5N1 include infectious and non-infectious causes for respiratory disease and ingestion. Additional differentials include mastitis and factors associated with decreased milk production, such as feed management and animal husbandry. For our veterinarians and others in the veterinary field working with cattle, there are several diagnostic tests available. The sample collected depends on whether the cow is lactating or if they're dry. For dry cows and heifers and calves, nasal swabs are the preferred sample to be collected. Lactating cows are different. The preferred sample is milk, and it is important to collect milk from all 4 quarters, as virus shedding may not be equal. It is advised to wear PPE when collecting samples. And this is a cross section of the mammary gland, the mammary tissue in cows, not a pig, as I've been told. So the treatment of HPAI H5N1 centers around hydrating the patient and supporting the rumen and decreasing fever. Supportive care includes feeding free choice hay or long-stemmed forage and administering oral drench and IV fluids. Probiotics, injectable B vitamins, are used to stimulate the appetite, and transdermal or IV flunixin are used for fever associated with acute bovine mastitis and bovine respiratory disease, and use them as per label instructions. The introduction and spread of H5N1 in cattle is not well understood. As with poultry, enhancing biosecurity protocols can help limit the introduction and spread of H5N1 in herds. Measures include limiting access to essential personnel and creating designated locations for visitors, vehicles, and equipment. Newly acquired should be tested, isolated, and monitored for 30 days before introduction to the herd. Employees should wash hands frequently and refrain from touching their face. Designated PPE should be worn, especially those that protect the eyes, nose, and mouth. Anyone who was exposed to an infected animal will be monitored for 10 days after the last day of exposure. The USDA Animal Plant Health Inspection Service issued a federal order meant to monitor and understand the extent of the virus and reduce the risk of further disseminating HPAI, H5N1. So a framework was established that outlines required testing for interstate movement and for reporting both PCR positive milk samples and positive influenza A serologic tests. USDA is offering financial assistance to producers, so please visit their website for more information. So the information in this section is pertaining to cats unless otherwise specified. As diagnoses in cats have become more frequent, there is more data available. Therefore, we will focus on the information that we currently know. Cats experimentally infected with HPAI H5N1 have been shown to shed the virus in their feces and respiratory secretions. Cats and other carnivorous mammals become infected when they consume infected material, such as preying on infected birds and eating uncooked poultry, eggs, or beef from infected animals. Cats especially have been infected when they consumed unpasteurized milk from infected cattle, raw cat foods contaminated with the virus, and ingesting infected bird fecal material while grooming. Experimentally infected cats shed the virus 3 days post-infection, whereas naturally infected cats sporadically shed the virus for about 2 weeks. Exact morbidity and mortality rates remain undetermined. Infections with neurologic involvement are associated with higher fatality rates. It is estimated that 50% of cats die from the infection. However, that number is probably grossly underestimated. There have been several reports throughout the region, as well as the nation, where cats belonging to large colonies suddenly disappear. If sick cats from these premises are found, they test positive for HPAI. On one premise in Region 1, 4 cats that were collected from a colony of more than 40 cats tested positive. The remaining cats were found or they disappeared within a 7 to 10 day span. So there are many clinical signs in cats, some non-specific, such as lethargy, inappetence, severe depression, unwillingness to move. And these cats will have a fever if the temperature is taken. Neurologic signs observed include ataxia or walking with a drunken appearance. These animals have an unsteady gait. They may be stumbling and circling. Their vision is also affected and they appear blind. They may vocalize, experience tremors, and seizures. Respiratory signs may include ocular and or nasal discharge, difficulty breathing that may present as heavy breathing with deep and fast breaths. Coughing is less common. So HPAI H5N1 can present like more common disease conditions. This differential diagnosis list, which was prepared by the American Animal Hospital Association, breaks down the differentials to be considered by the presence of respiratory clinical signs, neurological clinical signs, or the presence of both. A major disease condition listed here is rabies. To note, HPAI can also mimic canine distemper virus in our wildlife species. Okay. So pay attention to that kitty in the first video. So we have had several cats in the region submitted for rabies testing, return non-negative for HPAI. The kitty in the first video appears to not be able to see, and it is startled when it is touched. You can appreciate that it is breathing heavily despite no ocular or nasal discharge. We have also had high-risk rabies transmitters, such as skunks, raccoons, foxes, coyotes, test negative for rabies but return non-negative for HPAI. These animals have also been suspected of having distemper but turned out to be non-negative for HPAI. And that was the case with the skunk in this middle video. All right. The fox in the last video actually tested positive for distemper. If the video was playing, you would appreciate that it was experiencing a lot of facial muscle twitching. I wanted to show that because we have had some of these carnivorous mammals have that twitching that was thought to be distemper actually come back positive for HPAI. So risk factors to consider for cats presenting to clinics that have a fever, acute onset of respiratory and or neurologic signs, and have a rapid deterioration of their condition are as follows. It can be that multiple animals in a household are affected, and that can suggest a common exposure or even potentially spread of infectious disease. Cats residing on or near dairy operations where exposure to infected livestock and wildlife, such as rodents, raw dairy products, or fomites is possible. Owners associated with dairy activities, which would increase the risk of indirect exposure via contaminated clothing, footwear, and fomites. Consumption of raw foods is also on the list, and this includes raw or unpasteurized dairy products, raw poultry, and raw or freeze-dried commercial pet foods. Are cats having outdoor access, including those that are naughty and they escape for a period of time, may have encountered infected wildlife, or have had contact with outdoor cats? Cats known to hunt or consume rodents or birds, because these species can serve as hosts for H5N1, contact with a known or suspected H5N1 case, whether in other animals or humans, including exposure to infected poultry, wild birds, or contaminated environments. These risk factors can also be used for dogs, in particular those with outdoor access that hunt or consume rodents and birds. Of the diagnostic tests available, real-time PCR is what's being used. At least that's what we've been using here in the region. The test is being performed at approved laboratories. So in Texas, that would be TVMDL. The results are reported as negative or non-negative and sent to the National Veterinary Service Lab for confirmatory testing. If confirmed, those results come back as positive. NVSL does additional testing to determine the strain of the virus. There are several types of samples that can be submitted for testing, with oropharyngeal being the most reliable samples from multiple species. Our high-risk rabies transmitters must be humanely euthanized, sparing the head, and submitted for rabies testing. Although cats aren't considered a high-risk rabies transmitter species, feral cats with unknown rabies vaccination history are going to be treated similarly, especially if they're presenting with neurologic signs. Once rabies test is negative, HPAI testing can be pursued. For owned cats and dogs, the approach is different. Because rabies is a main differential, the current rabies vaccination status must first be confirmed. The risk of HPAI exposure must also be assessed and the need to test HPAI determined. If the rabies status cannot be confirmed, and if there was risk of exposure as previously stated, the animal will be hospitalized for treatment. Ensure that staff in charge of care are rabies vaccinated, first and foremost, but then as well, the appropriate PPE is worn at all times to minimize exposure. Veterinarians, please note that there is no specific treatment for HPAI, H5N1 in cats. Off-label use of antivirals are not recommended because we don't know the efficacy or the doses, which can lead to toxicities. Infected cats should be managed symptomatically and with supportive care that may include IV fluids, oxygen therapy, nutritional support, and antibiotics for secondary infections. Also be aware of how remains are handled due to the zoonotic risk, and this counts for both rabies and H5N1. Owners are not able to receive their pets' remains after euthanasia or death from rabies. So this has to be communicated with clients early on in the discussion so that they're aware that they may not receive their pets back. The best prevention method we have for cats and dogs is to reduce the risk of exposure, and that includes not being allowed to roam or house-proofing your house for escaping. They should be kept away from livestock, poultry, and environments that can become contaminated with a virus. Contact with contaminated objects such as clothing or shoes should also be prevented, and this is especially true for individuals who work with animals that can be infected with the virus. HPAI is reportable in wildlife and domestic species previously covered in this section. Any disease should be reported to your local veterinarian, the regional zoonosis vet, state public health vet, and Texas Parks and Wildlife. Suspect carnivorous wild mammals should be reported to your local rabies control authority, animal control, and your local wildlife biologist, or the nearest wildlife rehab facility. These animals will be tested for rabies first before any influenza testing is performed. Anyone who was exposed to an infected animal will be monitored for 10 days after the last day of exposure. HPAI H5N1 can be shed in the ocular and respiratory secretions of humans. To date, there is no sustained human-to-human transmission, and the risk to the U.S. public from HPAI type A H5N1 is low. Humans primarily become infected when their eyes and respiratory tract are exposed to infected animals and their secretions. This can be direct or indirect contact with sick or dead poultry, dairy cattle, cats, and other animals. The incubation period of H5N1 is estimated to be 2 to 5 days. From 1997 to 2024, there have been 919 human cases from 24 countries. And these cases include influenza A, H5 positive cases, and presumed H5N1 cases. The case fatality proportion, that is the proportion of people who died from the infection of the total number of people who were sick from the virus, is 51%. HPAI H5N1 infection presents with clinical signs and symptoms consistent with acute upper and lower respiratory tract infections, such as cough, sore throat, eye redness, eye discharge, such as conjunctivitis. There's also fever, rhinorrhea, fatigue, myalgia, arthralgia, headache. So basically flu-like symptoms. Gastrointestinal symptoms include abdominal pain, vomiting, and also diarrhea. There have been cases in the US where conjunctivitis has been the only clinical sign. The disease can progress to involve the lower respiratory tract, and that can manifest as dyspnea, which is difficulty breathing, shortness of breath, altered mental status, and seizures. To make things worse, there are complications that can occur, and pneumonia being the most common complication. Other complications include multi-organ failure, sepsis, and meningoencephalitis. So these radiographs show the progression of severe disease in 2 hospitalized patients. And if I can get your attention to the third the third from your left, we can appreciate this 21-year-old male illness at day number 5, looking at his chest x-rays. And just for those who don't know what we're looking at, the black is normal. The black is what we want to see when it comes to the chest because that is the available, that's air in the chest. So if you compare the other chest x-rays to that one, you can appreciate that the other patients probably were having a really hard time breathing, right? There's not a lot of normal lung tissue or there's a lot of infiltrates in there preventing normal respiration from occurring. There are several diagnostic tests available. Nonetheless, influenza A virus and H5 virus tests are only performed at public health labs. The influenza test available in clinical settings cannot specifically identify influenza A, H5N1 virus, nor can it be differentiated from other influenza viruses. The public health lab will also perform subtyping of influenza A viruses. So for patients that present with acute respiratory symptoms, a nasopharyngeal swab and combined nasal and throat swab should be collected. For patients with conjunctivitis, a conjunctival and nasopharyngeal swab should be collected. Those with lower respiratory tract disease should have nasopharyngeal swabs, combined nasal and throat swabs collected as well as sputum. If they were intubated, you will collect all those samples as well as endotracheal aspirate specimens or from a bronchoalveolar or lavage fluid. And remember, always wear your PPE. So there are certain occupations and lifestyles that are at higher risk of exposure. Human healthcare individuals, this is for you. The occupational risk should be determined for patients presenting with acute upper or lower respiratory tract infection with or without conjunctivitis or with conjunctivitis alone. The occupations listed here are all associated with contact with animals and their environment. Not specifically listed, but are also, should be also on your radar, are wildlife rehabbers, the wildlife biologists, our game wardens, shelter staff, the rabies control authority, animal fosters, sanctuary, aquarium, and fur farm workers. If H5N1 is suspected or confirmed, patients should be started on antiviral therapy and isolated. Household members or other close contacts should be started on antiviral therapy and monitor for signs of illness for 10 days after the last day of exposure. The best way to prevent H5N1 is to avoid sources of exposure, which include direct contact with sick or dead wild birds, poultry, and other animals, and observe them from only a distance. If you are a concerned citizen, sick and/or dead animals should be called into the proper agencies and not handled. For those who must have direct or close contact with sick or dead wild birds, poultry, or other animals, personal protective equipment must be worn. Remember, wild birds can be infected with avian influenza, and even if they don't look sick. Cattle can shed the virus before the onset of clinical signs. Carnivorous mammals may be infected with rabies, which is a fatal disease. Surfaces can be contaminated with saliva, mucus, milk, or feces and should not be touched. So, thoroughly cooking your food will kill the virus, and chicken should be cooked at a minimum temperature of 165 Fahrenheit. We know that infected unpasteurized milk can contain millions of viral particles in a few drops. So therefore, raw milk and milk products should not be consumed, especially from animals with confirmed or suspected avian influenza A virus infection. The seasonal flu vaccine will not protect you against H5N1. However, it can prevent co-infection and decrease the chance of reassortment between the two viruses. H5N1 is a reportable disease. If a person is suspected of having the disease or has been exposed, the person should first seek medical care. Your local health department, regional zoonosis vet, state public health vet should be notified. So far in this presentation, I've mentioned the importance of wearing PPE to reduce exposures to avian influenza viruses. So you're probably wondering what kind of PPE specifically at this point. So the kind of PPE needed depends on the level of exposure associated with the work setting and task to be accomplished. A site-specific hazard assessment should be performed to identify workplace hazards and prioritize controls, including the use of PPE. And this is recommended for all facilities that will either have workers come into contact with infected animals or facilities that may attend to persons that may have been exposed to the virus. Controls are placed in a preferred order of action to reflect the most effective to the least effective actions to best control the exposure to avian influenza A viruses. Engineering controls reduce or prevent hazards from coming into contact with workers, and engineering controls are more effective than other options because they don't require ongoing efforts by workers and their supervisors. Whereas administrative controls establish work practices that reduce the duration, frequency, or intensity of exposure to hazards. And personal protective equipment is worn to minimize exposure to hazards, but to be most effective, our PPE must be put on and taken off correctly in a specific order. So an example of a hazard assessment worksheet is seen here, and this one was specifically crafted for dairy facilities. So there are questions to determine the presence of the virus, classify their presence of the virus, like what's seen here in this image. There's also questions to classify the exposure level, questions according to monitoring workers for avian influenza A virus, and identify where and which controls are needed. Okay. So once a hazard assessment is completed, the facility will be classified as low, medium, or high exposure, and the appropriate controls are then recommended. So for a dairy with a low level exposure, we can see that there are administrative controls are recommended, and this can include watching for sick or dead animals, monitoring animals for changes in feed consumption, developing plans to monitor workers for illness, working with state or public health department to offer flu testing and PEP of workers, developing flexible leave policies to support workers to stay home if sick are also part of administrative controls. In the high and medium exposure setting, the following engineering controls can be implemented, and that includes using ventilation systems that provide a constant supply of fresh air, for instance, strategically placing fans and vents to generate a clean to less clean flow path of fresh air through the space while removing dirty air. Use airflow exhaust and makeup air supply strategies that do not discharge high velocity airflow upon building occupants is another recommendation, and then regularly cleaning and maintaining ventilation systems to minimize the accumulation of dust, feathers, manure, and other debris that can block airflow and provide a breeding ground for pathogens. All in all, there may be financial restrictions that will influence your ability to implement some of the engineering controls in medium to high exposure levels. Now, as far as PPE goes, what is used will depend on the exposure level. So looking at the table, you can appreciate the amount, you can appreciate the type of PPE creases from low level to exposures in high levels. If the tasks you perform are classified as medium exposure task, it's recommended to use NIOSH approved particulate respirator, safety goggles, disposable work gloves. But for limited high exposure task, the same PPE is used, and also fluid resistant sleeved aprons, optional face shields over the goggles, boot covers or boots, head or hair covers, disposable gloves with optional outer work gloves. Lastly, let's not forget disinfectants. Regardless of the setting or the species involved, disinfection is a must. Influenza virus type A is an enveloped virus, and the group of infectants in the red box can be used to kill the virus. As stated before, PPE should be worn, and PPE should also be worn when cleaning and disinfecting. So where are we now with this outbreak? As of April 18th, 2025, 24 affected premises have been reported in Texas. There were 22 confirmed premises that had positive lab results from a bovine, whereas there were 3 suspected premises that have positive lab results from another source, such as feline or avian. Whoa, I am so sorry. There has still just been 1 human case reported, and this was due to occupational exposure at a dairy. There have been 10 persons monitored with no progression to clinical disease this year. Last year, Texas, Colorado, and Michigan were the only states that had positive human cases. We are now up to 13 states and 70 human cases. 41 were due to dairy cattle exposure. 24 were linked to poultry farm and culling operations, and 2 exposures were related to exposure other animals such as backyard flocks. And there were 3 cases that were considered unable to be identified. Of the human cases, there has been 1 death. Now, all in all, there are 17 states that are reporting affected cattle. The number of detections as of the April 18th is 1,021. Ongoing detections of H5N1 in poultry has been going on, and there has been spillover from the bovine outbreak into the poultry sector. Ongoing H5N1 detections continue in our avian and mammalian wildlife. Now, since February 22, there has been a total of 1,674 flocks affected. That number is 168.26 million birds. There's been 779 commercial flocks, 895 backyard flocks, and all 51 United States have been affected. As far as wild bird goes, you can see the distribution here and that we have had in Texas. In Texas, the type of birds that we've seen include grackles, snow geese, cackling geese, Canada geese, red-tailed hawks. They have all returned positive. In recent weeks, we have had cases of wild mammals in the Panhandle return non-negative, and this map reflects that. We are reviewing our negative rabies results for the potential of HPAI infection. The species' presence of neurologic signs as well as cluster cases are investigated. It's very unlikely that a neurologic skunk, fox, coyote, or a raccoon that if they're submitted because of the neurologic presentation and they're not rabies, there is something else going on in these species. If it's not rabies, then could it possibly be HPAI? And we've seen that that has been the case. Not always, but more so than not. We are unsure how the virus is being transmitted between cats. It's possible that they consumed dead, dying birds infected with HPAI. There is also the concern that we may be seeing mammal-to-mammal transmission. The samples from the region are being sequenced to determine if we are dealing with either of the current circulating H5N1 genotypes, which is the D1.1 or the B313. And this is a joint effort between the SHS, USDA, and Texas Parks and Wildlife. This information is crucial for everyone who works with animals and who owns them as pets. We know that feral cats can serve as a bridge between wildlife and domestic animals and humans, thereby increasing the risk for human exposure. The virus has always and will continue to adapt. As stated previously, there is no sustained human-to-human transmission, but if left unchecked, that may eventually occur. Some may call this fear-mongering or a conspiracy theory, but for those of you who have seen the effects of this virus, whether it's the mass animal die-offs, the individual wild mammal deaths, the pet cats that become ill and die, or the outbreaks in the dairy cows, as well as illness in people, we know that something different needs to be done. So zoonotic spillover of pathogens from animals to humans is recognized as a predominant cause of emerging infectious diseases as a primary cause of recent pandemics. This spillover risk is increased by a range of factors that impact the nature, frequency, and intensity of contact between human and wild animals. Many of these drivers are related to human impact. For example, deforestation and changes in land use and agricultural practices. Another driver is globalization, travel, and trade. In this instance, pathogens can make their way around the world, whether it's in a person, an animal, or a vector like a mosquito, in less than 24 hours. So because wasn't done here yet. There have been several spillover events from influenza-type viruses throughout the years. Spillover from wild birds to domestic poultry, cats, cattle, and humans, each time occurring at environments that allowed close interactions between the infected animals and susceptible hosts. So what if these interactions can be identified and minimized before a spillover event occurs? What if emerging or re-emerging diseases can be identified before causing an outbreak? What if plans were in place to limit the spread of zoonotic organisms in human populations? So the One Health approach can prevent outbreaks of zoonotic disease in animals and people, can improve food safety and security, reduce antimicrobial resistance, infections, and improve human and animal health. The One Health approach can also protect global health security and biodiversity and conservation. A One Health approach should focus on the prevention of spillover events, such an approach starts with the human-animal environment interface, and this will require a shift from a reactive approach to a proactive approach. We do not know how this virus is moving in the environment. In fact, we really do not know the extent of its spread in the environment, but we have witnessed its impact. The impact of millions of dead birds and subsequent mammals. By the time these die-offs occur, we are already behind. We need to do better by communicating and sharing information across all sectors, including research. We need to adapt a preventative mindset in our approach to zoonotic diseases, because this is more than just bird flu. There is an economic impact, poor mental health influence, and pandemic potential. When we're talking about economic impact, we're talking about the livelihood of the industry, and we're talking about all industries. Although it has not been identified in swine, the swine industry is on high alert because we know that swine can become infected with influenza viruses. We've seen the impact in the poultry and dairy industries, so what would that look like if swine were also affected? Trade implications are also a concern. With the presence of bird flu, what does that mean for trade nationally and internationally? What about if we begin vaccinating our animals? What does that also mean for trade? If we consider what's done or what the plans are for foot and mouth disease, we know vaccination in cattle for that will impact trade. So vaccination in poultry, how does that stand? Oops, I'm not done. And the economic impact, us as consumers, we are also seeing in real time the influence that bird flu can have. Or the cost of food products, particularly eggs, have gone up, and eggs have been difficult to obtain because of the number of deaths that are occurring. What about mental health? Well, that can cross over a number of professions here. Okay. It can be for the employees, the people who work on the farm. It can be for the farm owners. It can be for attending veterinarians, but it can also be for physicians who are dealing with individuals showing up to the clinic, not knowing what's going on, or perhaps not knowing how to approach. So job security is impacted by this virus. What about witnessing the impact of the virus? Therefore, treating the number of sick animals, but also during depopulation. Whether you're seeing your animals die or be euthanized, or if you are taking part in the depopulation as part of your work duties, all of that takes a toll on your mental health. There's also the non-uniform response that has happened with this outbreak, mainly because we didn't know what was going on initially. And by the time we figured it out, it was already raging in the cattle population in Texas. So there was a lot of uncertainty in outcomes. And the uncertainty, again, revolved around, well, what would happen to the cows? Because if we consider what happens to poultry with bird flu, all these birds, if it's detected, are going to be, there's a depopulation that will occur. So the fear around what would happen with the cows was very real and very palpable. What about a pandemic potential? At the beginning of this presentation, I talked about how many pandemics occurred throughout the years because of influenza type A viruses. What we have circulating right now is an influenza type A, particularly H5N1, and it has the mutation in the PB2 gene has been detected. That gene, what they've discovered, makes it more possible for this virus to infect humans and then be transmitted humans to humans. So the potential that this particular outbreak can trigger an epidemic or a pandemic is very real and should be taken seriously. We all lose when there is an epidemic, and we all lose more when there is a pandemic. And that's it.